Well, joining me now is Professor Tony Blakely from the University of Melbourne. Tony, we have that announcement coming tomorrow morning. We are expecting a lifting of some of those limits on gatherings, the end of QR code scanning and vaccine passes and mandates. There may be some movement in the next couple of weeks on those. Does that sound like the right approach to you?
Yes. You've gone up the tabletop mountain. You haven't let it go as high as a volcano by keeping measures on. Now you're there, you can start to relax measures off. That will see you stay up there for a while before you start to come down again. And that is appropriate. Exactly what recipe New Zealand used will differ from other countries, but it is time to start doing some relaxation.
And what does coming off that mountain or coming off that peak look like for us, Tony?
Well, on the sheer numbers side, over here in Australia, there's been quite diverse experience across the states, but where I am in Victoria, we came from 1,200 down to about 200 cases per day, and we're bobbling around at that level at the moment. So you would expect to see, it's like you're coming off a tabletop mountain into the foothills, you'd expect to see it rolling along for a while. From the New Zealand perspective, because you've had the Omicron BA2, the new Omicron variant, you may come down and stay a bit lower than what we're experiencing here if no other variant arrives.
Tony, what about mask wearing and social distancing in the workplace? I know that will be really important and something that many people are looking forward to. When would you think that we could expect to sort of start relaxing those kinds of rules?
All right, that was about 2 weeks ago here. That was a pretty hot issue with the central business district and the employers wanting people back to work, and people didn't want to go back to work if they were in an open plan workplace with their masks on, which is quite understandable. I would expect that sort of pressure will come on in New Zealand soon, and as long as your numbers coming down, particularly hospitalisations, I think it's appropriate to allow people in an open plan workplace to take their masks off to make it more convivial, and then there'll be general relaxing like that. What this all means is that Omicron is going to infect as many people as Omicron needs to infect to get to an equilibrium with what you're doing as society. That means, quid pro quo, that there will be a lot of young, fit and healthy people get infected, hopefully mildly. Got to get vaccinated to reduce that. The flip side of that is we always protect the elderly, those with comorbidities and the immunocompromised. They should always be wearing good quality N95 masks, keeping up to date with their vaccines, because they're the very people that we don't want to get infected whilst we let this virus wash through our society.
And Tony, we seem to be quite used to now the Omicron variant. We are living with this virus, but what does the future look like if we get a new, more deadly variant and now our borders are open? And what is that going to be like for us and for you?
Well, hopefully it's going to be good, but we cannot guarantee that. We're actually extremely lucky that Omicron's come along at the point that we're all vaccinated and wanting to open up, because it's less virulent, less likely to put in hospital and give you serious illness. We hope that whatever next variant comes is also low on that hospitalisation mortality rate and will, by natural selection, be a little bit more infectious. But unfortunately, we cannot rule out the possibility of a variant coming along that is far more likely to put you in hospital. If that happens, we may need to go back into working at home and all those types of measures. I'd hope not, but we cannot rule that out.
It is not over yet. Professor Tony Blakely, thank you for joining us tonight.
Pleasure. I hope that was useful.